There's always activity going on at the hospital, always. And it could be GMH, it could be Navy Hospital, and now it could be GRMC. And we're going to meet some of the personnel today from GRMC. In the studio, we've got Kathleen Ho. She is the Chief Nursing Officer at GRMC. And Kevin tells us she's got more than 14 years of experience and a lot of background in nursing, and she actually went to GW High School, and we'll talk a little bit more about her background in a minute. We've got Glenda Guerrero. She's the nurse manager. Before you probably got up today, she was working on making sure babies got into the world safely and soundly. And then we've got Mr Whitley, a gentleman that is the manager of the Perioperative Services, and I hear they call him Whit. Whit, is that right?
Yes, it is.
Okay. So welcome, everyone, and thank you very much for taking time out of your day to stop by.
Thank you for inviting us.
I appreciate it. I lived in Dedado right about the time when the hospital was going up at GRMC. I drove by, was thinking every day, man, this is really great for Guam. I'm pretty excited about there being a new facility here. Now you've been open for a while and been able to work out some of the kinks and working into a regular routine. I guess my first question has to be from a nurse perspective, how are things going? Would you like to field that one, Kathleen?
Sure. Yes, I actually started even way before the hospital opens, the building. So it was something that I see. I was told about what they want to do for the island, how they're going to take care of, provide the health care that it's actually not available for for our community. So for me, I see it as a challenge, and I like to do challenge, and I see it something like, at least we're starting from the beginning. So it was really a challenge, and it was a good challenge because we know that we're part of this. We're from the beginning, and then there's still more challenges coming. That will come along, but we're there.
Well, how did your career end up with you as being the chief nursing officer? I understand you went to school at GW, and then you got a bachelor's in science of nursing from the University of Guam. Did you study with our friend Margaret Hattori?
Yes, actually, I did. She came in a little bit later on the program. So yes, but we had her as our instructor.
Oh, okay. And right after that, did you leave to become a nurse?
Yes, I actually started at Guam Memorial Hospital. I worked there for several years, and I worked as a unit supervisor for surgical unit. And then like I said, from there, I spent about 14 years at GMH.
Oh, okay. So a lot of time nursing at GMH, and then I saw that you earned a master's in business administration and healthcare administration from Loma Linda University. Okay, that's a pretty big jump from working in nursing to going, you know what, I need my MBA. What led to that decision?
Well, at the time, I was in Guam. I wanted to do something more for nursing and expand to probably go on a graduate school, but I didn't want to leave Guam.
Right. Yeah, I hear you.
So I have to look at opportunities, what I can do here.
Okay.
So an opportunity came along when the Loma Linda group came in and offered the MBA course. So I was one of their first batch.
Oh, okay.
Yes.
So you knew you wanted to do more. You weren't exactly sure what, and then this opportunity presents itself. You went, perfect.
Yes. So it was just perfect. I needed something to do. I needed to get into a graduate school, and that was the first. And then after that, online classes are become more available for us here. So that's why I pursued the next level, which is focus on nursing.
Okay. Well, I would imagine being a nurse at GMH for a few years gives you an idea of like the same kind of idea that lots of us get. Well, if I was in charge, I might do things a little bit differently. Once you started getting in more supervisory positions, did you experiment with that a little bit?
Well, I did. I wanted to, take on a little bit more challenge. Started, of course, leading a smaller group to a bigger group. Now I have a whole team.
How many nurses do you have at GRMC?
GRMC, I have about 137 of full-time staff.
Holy guacamole, really?
Yes, not including the 50 part-timers that we have.
Okay.
So
more than 200 nurses, including the part-timers?
Yes.
Okay.
I should say yes.
What's the key to making everybody happy?
Communication. They need to be in the loop with what's going on with the hospital, and you need to make yourself available, and you gotta have to keep the managers happy too, because they're the first stop for the employees.
I see. Well, maybe we could move to, maybe you could tell me a little bit about our other guests before they tell me about what it is that you do. Kathleen, could you tell me a little bit about Mr. Whitley here?
Okay, so Mr. Whitley, I've known him since from GMH. He's worked with me also as a supervisor. We actually worked side by side at that time.
Okay.
So he's very much knowledgeable and skillful in the operating room services. So at the time, he actually moved out of GMH to go to Naval Hospital. And I kind of gave him a call. I said, "Whit, would you like to come and help us?"
Oh, really? So you remembered the quality of service that he provided? Yes.
So I said he's very good at what he does. So I told him, I said, there's an opportunity here. And I told him about the vision and the goals for the hospital, and he agreed to do it with us. So.
Yeah, wait, is that how it happened?
Actually, it is. Like I say, Kathleen said, we have known each other for a couple of years. And it really was like that. When I first came in, I was the only male on the staff, and they all took good care of me. But I like going to OR, and I like being with them. So when she called me, she sounded like it was kind of interesting, something I'd like to do.
Okay. Now, what is the manager of the perioperative services? Tell me about that, John.
It's a lot of words that means I work in the operating room.
Okay.
And I run the operating room. We do anything from something as simple as endoscopic, which is colonoscopies, sigmoidoscopies, to things as great as open hearts, doing total joints, knees and hips, neurosurgery, and I like surgery. So when I had a chance to do some things I wanted to do, it was like kind of interesting. I could build teams the way I wanted to build them.
Really? And what sort of teams? How do you build a team for your purposes?
You build a team by look at people beyond what they think they can do. For me, I like everything. I mean, I learned early in the game that if you want to be good, you need to do all the menial tasks so you can do the big tasks.
Right.
So for me, I look at what they can do, and I look at what I think they can do in the future. So I have most of my staff is brand new because we have to homegrown most of our staff, and that's not because we don't have a big pool because we're here on Guam, and we got 3 hospitals. We all vie for the same amount of staff. So I learned from OJT, so I like OJT because in OJT you can teach them the good things.
Okay, the on-the-job training. This is the way it is at this hospital, and working with us, and this is what is going to help here.
Exactly, and the people I choose people that I know is going to stay on the island. I mean, my heart is on the island. My wife is Chamorro, and my kids were born and raised here, so this is home for me.
Understood.
Yeah, so I look at what the island what the hospital can bring to the island, and what I can contribute to that. And I like GMH because GMH, again, was the place I started at. They gave me a chance to do something when I retired from the Navy. So when I came over to them, it was nice to go into the operating room to do the things they do. They did great stuff, and they still do great things. We're just going to add a little bit more to their plate.
Okay, well, I mean, let's talk a little bit about that. What does GRMC, what are some of the things that GRMC provides now that GMH maybe doesn't provide, or some of the things that you're working on to provide in the future?
Well, GMH, they offer, we're working on the idea of having our own heart team. And we started doing hearts. We did 6 hearts last year in December, and they went well. But now we want to do it on a regular basis. So that means that we develop the cath lab team, we develop the CT team, and then we develop the ability to be moving up between both of them. So the idea is that we bring in the right mix of people to do those that have that skill mix. And then my job is to try to make sure that when we have that skill mix, that we can do it and do it in a safe fashion. And Hearts is part of what I do, so I'm part of that team as well. And the cath lab I got a chance to be with this year because it's something that's new, because normally it's not in the operating room, but now it is. So now I get a chance to really look at it and really understand that part of the work.
The cath lab?
It's the cardiac cath lab or the interventional radiology. It's where we do a lot of diagnostic procedures before we can do the procedures that we do in the open hearts and the things that neurosurgery want to do. The call-ins for aneurysms, the CT scans for looking at a patient. We're going to look at if we're going to do an open heart, what vessels are good, what vessels are bad, how can we diagnose what they need. So we do all that there, then we move them over to the operating room where we actually do the procedure.
Yeah,
and we take all those nice pictures and we put them on the board and we look at them and then we map the plan and go with the flow.
We are talking with a group of the senior nurses at GRMC, and it really is a pleasure because, I mean, if you're a patient, the conversation is usually related to, okay, we're going to go ahead and do this. It's going to hurt just a bit. And, you know, not so much personal time, but I thought we really could get to know some of our nurses that are at Guam's newest hospital, and we'll continue our discussion in just a minute. What does GRMC stand for? Guam Regional Medical City. Okay. Yeah, just checking. We've got three of the senior nursing staff, Kathleen Ho, the newly appointed Chief Nursing Officer. We've got Mr Whitley. He is the manager of the Perioperative Services, i.e. he's in charge in the operating room, putting the team together and what have you. And we've also got Glenda Guerrero, who we haven't even had a chance to talk to. Let's see. Kathleen, how would you describe what Glenda does?
Well, it's sort of similar to Mr Whitley. I have worked with Glenda before. She was actually my supervisor. And although I work in surgical unit, but she does nursing supervision, so there were days that she will be my supervisor. So she decided to go ahead and retire. She's contributed many years, I should say. I lost count already, Glenda. But many years at GMHS. Started with their maternal child unit, also labor and delivery. And like I said, she retired, and she did also went to, I believe, school nursing after her retirement from GMH. And like I said, I saw that as an opportunity because we want to build our team, and we wanted only the best people that have many years of experience, because we're just a startup company also, and we wanted to make sure that we know the people that will run it are people with experience. Okay,
and people that you know helps as well. Glenda, is that about how it happened? Where you just relaxed comfortably in retirement, and then they drag you back in?
So I did retire, but you know, I don't think as a nurse you could ever retire. This opportunity came about, and I thought that it was a great opportunity for the community, first of all, and just to start from the bottom up. And like Kathleen said, it is a challenge, and I like challenges. I just like to start things and see how they grow.
Yeah. Sorry, I was trying to send your picture to Paul. I got caught myself not on the microphone. I wanted to ask you, you worked in the maternity ward at GMH?
Yes, I actually managed the labor and delivery unit for many years. Okay.
Now, I have come to hear that it is among the busiest in the world. So I'm not at all shocked about you having seen a whole lot of scenarios. Given that, and given all of the work that you've done over the years at GMH, where does GRMC fit in the big picture? I mean, what are the differences? What are the similarities, would you say?
The differences, the similarities are, nurses are, we are actually providing care to both mom and baby. And I think, the difference right now, and the thing that we've started at GRMC, is that we keep mom and baby together. we do not separate them. With a mom will actually labor, deliver, recover, and go home from one room. The only time that we will separate them is if the baby needs a higher level of care, which is a NICU service.
Okay. And that's the neonatal ICU? The
neonatal intensive care unit, that's
okay.
Correct. Or if mom, again, is not, or if mom is in the OR and needs to recover, we would usually bring them together, but then allow mom to recover for a little bit, and so we would separate them for just a little bit.
Oh, okay. Well, hang on here. I've got a lot more questions, and we don't have that much time before the top of the hour. Would you stay after the CBS News? She said sure. Nervously looked at Kathleen. Are we staying?
Ask my boss.
We can do it. Don't worry. It's Friday afternoon. Plus, you're out of the hospital just for a little while. What we have for you right now is positively life-saving. Because, I mean, think about it. It's all about you've heard really good news. Oh, it's your birthday. And you're not feeling very good. Too bad. So sad. It's not a great day. If you don't have your health, what have you got? And if you live on Guam, hearing, I'm sure, that we've got a new health care facility, a new hospital, GRMC, with some great news. And for a while, a lot of people were wondering, what will it be like? What kind of a hospital will it be like? Well, we're starting to hear more and more stories happening from GRMC. And I thought it's high time that we start to get to know some of our friends that are helping to keep that hospital going. So today in the studio, we've got Kathleen Ho. She's the Chief Nursing Officer. We've got Mr Whitley. He's the manager of the Perioperative Services, being in charge there in the operating room where he wants to be. And Glenda Guerrero, who we're just chatting with, she's the nurse manager of the Maternal Child Health Services, oversees the maternity ward. And she was just talking to us as well. So once again, thanks everybody for being here.
You're welcome.
I really appreciate you having you by. So just size-wise, bed-wise, how many folks do you handle, Glenda, at your maternity ward?
Okay, because I take care of the maternal child area, I have a total of about 40 nurses, CNAs, unit secretary, or technicians. And that's just, I mean, that encompasses the labor delivery side, the nursery side, and the pediatric side. Mm-hmm. So, you know, if you divide that, I mean, we're still in critical need of staffing.
Oh, okay. Well, we hear a lot of the news about the need for H-2B visas for nurses. From your perspective, what does that mean for staff at the hospital, for nursing staff at the hospital?
Well, what I know is when we've lost our nurses to the visa and they had to go home, we had to close several services. And pediatric was one of them, and our NICU service was the other. And so I know that with us not having these nurses with specialty skills, and with the limited resources here on our island with skill nurses of the different specialty areas, it is a challenge. And I am just glad that, you know, GRMC is looking at every avenue to try to provide us with the skilled nurses that we need to continue to provide services to the people of our island.
Okay, and you're all veterans as far as nurses. You're veteran nurses. You've been involved in healthcare here on Guam for lots of years. So you've seen lots of people come and go over the years in nursing. Tell me about if you could build a nurse that would be perfect for Guam, what kind of nurse would you build? How do what sorts of personnel or people fit best?
I think for us, when you first get out of nursing school, everyone is used a med-surg nurse. And that's the nurse you want. You can mold that nurse to be anything you want.
Oh, is that right?
The first thing my instructor told me, she said that if you just a general nurse, you can go in any area and work any place. Mm-hmm. When you become specialized, we get so specialized in our compartments that sometimes we don't want to venture out anymore. But if you ever get that foundation, which all of us have, as generalist nurse, that is the best nurse you can be, because you can move a manager of a maternal child unit, operating room, run your home or hospital. That's how far you can go as a generalist. When you become specialized, you do great things, but you limit it to your sphere.
Oh, I see.
We look outside our sphere. So when you talk about us as a team collectively, we treat our team, because Glenda ward is right next door to my ward.
Okay.
Kathleen office is right below my office. And we always talking in the morning. We always discussing staffing. We always discussing the different patterns we're discussing the shortfalls we have, because we have to talk to one another. And that's what makes us a great team, because we do talk to one another. And a generalist is what you need, because a generalist sees the bigger picture. And that's what you want them to see. You want the person to be able to walk in the door and say, okay, this is med surg, I know what I need over here. This is ICU, I know what I need over here. This is the OR, I know what I need over here. So when Kathleen started reaching out to us, she saw the pieces and parts. It's like going in a car. I'm going to take this color car, I'm going to take these wheels, I'm going to take this truck, and when I put it together, I got a monster ride.
Now, when when your respective departments need someone to help out, to fill in, do you help each other out, or go, sorry, man, not my...
No, we actually do. I mean, if a staff can't bring their patient over, we'll pick her up. If we need some help in the operating room, they'll come over there. If we can't get started because we are a little bit further away, her team will pick up to where we pick up, and then we'll come in and we'll take the ball and run. So we go to different areas. We do different things. I deal with ICU, I deal with OB, I deal with admin. So we actually deal with each other on a daily basis every day.
It's got to be nice working at a brand new hospital, one that was just built, that has, when everyone has lots of experience with the way things have always been, working at facilities that have been around for a while. What are the advantages of working at a brand new private hospital?
The advantage that I actually seen is, you've got this idea, you can actually implement it. You just got to figure out the workflow, and then you can actually take off with it. And that's one of the advantages. You can start new programs. You've asked me what was the similarities and the differences from GMH and GRMC. What the similarities are, you've got really dedicated staff at both ends, at GMH and at GRMC. And it'd be great because of the shortage of skilled professionals in our island. It'd be just great that we could just kind of work together for the sake of our community. People want to try different things, and that's probably why they come to the new hospital. And we have done a lot of things differently. We started new programs. We kind of adopted the birthing center kind of atmosphere in our facility. So and that is more geared to families and sibling participation. And so that's what we've actually have done, and that's why it's great to kind of come from something new to start something from the ground up.
Oh, okay. And how are siblings going to participate in the birthing process?
So the mom has a choice if a child is going to participate. They understand that there's got to be a responsible adult, because we can't expect mom to be laboring and be telling her 2-year-old to say, hey, stop.
Oh, okay.
So there's got to be a responsible adult to kind of care for the kids. So if mom says, I want my 2-year-old to watch my birth, that is mom's decision, as long as the family does not impede on any of the nurses'
right.
Way to provide care to her, then we will allow it. So it's really up to the patient herself.
Okay.
Yeah.
I got this question for you. You've worked at GMH, you've worked at Naval Hospital, both different sort of government facilities. Now we've got this private facility. Is the day-to-day a little bit different working in a private hospital?
In some respects it is, but far as surgery, no. It's the
Not
same.
at all. Exactly the same.
No, we do the same. We there to do this surgery, and my job is to keep working. So if we have 20 patients, I'm happy. We have 2 patients, I'm happy. They all get treated the same. So all we want to do is work. So in every hospital I've ever worked at, that's all we wanted to do. We wanted the OR to be able to run, to be able to take the cases that we need to have them done, to do the emergencies that come through the door, and just get the people in the community itself seen, and did it in a quick fashion.
How big is a team that you put together for a surgery?
Actually, really, if you look at a team consists of 4 people. It consists of anesthesia.
Okay.
It consists of a technician, an operating room nurse, and maybe an extra hand to move the patient from one place to the other. So, in essence, you can do 3 people in a room, and that's a team.
Okay.
If you're doing trauma, depends on how good you are, you may have 2 other people added to that team. And that sounds crazy, you're talking about a trauma coming in the door, but we work so well together that we all function on the same level. I can function as the guy that sweep the floor. I can function as the guy that, to scrub the case. I can function as the guy that circulate the case. If anesthesia needs some hands, that's what my job is. So we all do several different jobs because that's the way we made.
When you watch surgery on TV, what's the part that makes you go, "Oh, come on"? In the operating room.
Not true.
Actually, I don't watch that much surgery on TV, believe it or not. And I like just what I do. And believe it or not, most of the times the shows I do watch, they're actually pretty close to what we do.
Oh, is that right?
Yeah,
okay, so they're getting it right these days.
Yeah, they actually very good at what we do. The only thing different is that they just live a little bit longer.
Oh, okay.
They languish longer.
Oh, I see.
But the essence, when trauma comes in the door, that's exactly how we come in the door. How you see the guy coming in with their hands on chest, pumping somebody's chest. That's what happens with trauma for us.
Okay, so that's real life.
Yeah, that's real life.
Okay, all right. I always wonder. We get different professionals. Those going, okay, that is never going to happen in a real hospital.
It does happen.
Okay, it could all happen.
Yes, it can.
It
does.
Yeah, we've got. We just heard from Glenda Guerrero. That was Lester Whitley. He goes by Whit. Now, in your job, are you the only one of you at GRMC? I mean, the only person that's going to be in charge of the operating room? No,
actually, I have a charge nurse that works with me as well. And her job is to run the day-to-day, and I run the behind-the-scenes.
Okay.
But I'm not a behind-the-scene guy, so I'm always out in front, so she always get mad because I miss my meetings. I'd rather be inside the room than be outside. But I like what I do, and the only way I can do it is to be in it. And for me, my biggest goal is if I can impart all the things in my head to someone else that doesn't have anything in their head, and I can walk out that door tomorrow, then I'd be happy. Because that makes me the smartest man in the world, because I gave everything I know away. And that's what I want to be.
And, well, it sounds like there's lots of opportunity then at GRMC.
It is. If you're willing to work, and you have a vision, you have a goal, and you want to see something different, then all you got to do is present it. And that's the good thing about the teams we have. You can present, like, I have the final say-so, but 95% of the time, if you offer me something, I let you run with it. I reserve the 5% for me to make the hard decisions. But if you think you can do something better, and I think it's more safe for the patient, then we can go with it. We'll give you a shot.
Well, thank you for that. And finally for you, Kathleen, if you could wave a magic wand and say, this is what I'd like to give GRMC today, what would you give them?
For GRMC?
Yeah.
I need 80 nurses.
Okay, that's a big ting, bibbity, bobbity, boo. 80 nurses?
Yeah.
Holy guacamole, what kind of nurses?
Of course, it ranges from the specialty unit, LPNs. We're open to getting LPNs as well. And of course the registered nurses. So if I have that wand, that's what I want, an 80 nurses, so we can open up all our beds.
Okay, how many beds do you have versus how many beds are open?
Sure. We supposed to be 130 bed capacity. Right now we open 48 beds. Actually, I just wanted to add on today, because we're so busy, our ER is so full, we added additional 5 beds.
Oh, is that right?
Yes, so now we're up to 53 beds. So we're really getting busy, and we are really needed. The services are really needed by the community. So if we could, like I said, that's one thing that I would want, is to get those nurses.
Now, where do you think we're going to get those nurses?
Right now, we are trying. We have some recruitment efforts, and first of all, we have to look at what we produce here on island. And we do have 22 nurses 22 graduates from nursing program.
Okay.
And that's what we're waiting for. We're waiting for them to take their boards, and we're waiting for them to pass it, and they can start working. And then also, I believe GCC is producing licensed practitioner nurses also, and we're open to take them in as well.
Okay, this is probably going to sound a little dumb, but Paul was ready to marry a nurse, so that she could come from another country during the H-2B visa. He proposed that. Do we have a marry a nurse program?
Not really quite sure right now because we don't have them here, so he might have to go Philippines and find them.
And go just sort of troll the hospitals and look for someone that's got pictures of like a beach, near their desk or near their workstation.
Yeah, we actually only have 13 left, so I think majority of them are male.
Yeah.
So.
Oh, okay. Are they married? I'm just kidding, Paul.
Don't know that detail.
Okay, well, we'll work on that. Just don't let it be said I didn't throw it out there, because we're willing to go down any avenue to help with the nurses, and we certainly appreciate you guys being here this afternoon. Is there anything that you wanted to say when you were on the air that you didn't get a chance to say?
I think for me, we have 3 hospitals on the island. And all of us, again, vie for the same needs. And I think the biggest thing that we have going is that the ability for us to cross those boundaries is a good thing. We don't try to steal nurses, but we welcome any nurse that want to come to us.
That's right.
Whether
So if they just happen to come on by.
If they come by and they want to work, we will offer them a chance. But we don't go out and take them from anybody because we feel like where they are is just as important as where we are.
Okay.
And we need them to understand that. And over the months, you hear all kinds of stories about what we do and don't do.
People are worried. Don't take our nurses.
Yeah.
What are you doing in here?
Right.
Hey, they're from GRMC, but you wouldn't do that.
And we don't do that. I mean, we offer them challenges, we offer them chances. And the majority of them come because they want a challenge. And they want to do something different. And they want to see the new building. Like anybody else, they want to see what
they want to come inside and have a look around.
Exactly. So we welcome those visits, we welcome those nurses. But again, we do not go and elicit for those nurses to come and leave them to come to us.
Okay.
And to me, that's more important. Do people really
Well,
know that?
Usually the best question doesn't come from me. And thank you very much for adding that to our discussion, and thanks for being by. So now, if you happen to be at GRMC, at the very least, Kathleen, Glenda, Whit, and if you see Whit, you probably got more problems than introduction. But best of luck to you. No, I'm just kidding. Thanks again for coming by this afternoon.